With 1 out of every 3 women now delivering by C-section, many, many more women like yourself are beginning to ask the question, can I have a vaginal birth with my next pregnancy? And the good news is more and more women are attempting vaginal birth after C-section, and 60 to 80% of them are achieving just that. If we haven't met yet, I'm Jocelyn, a labor and delivery nurse and prenatal yoga instructor of 20 years. I've worked and gained my knowledge at some of the best medical institutions in this country, including Johns Hopkins, Mass General, Cedars-Sinai, and UCSF Medical Center. I work with women to educate, empower, and help them prepare their bodies for the delivery of their choice. If you are not sure yet whether you want to try for a vaginal birth after a cesarean or a VBAC, then this video is going to walk you through the decision process. Let's start with some of the pros of having a VBAC as opposed to a planned C-section. The major benefit, of course, to having a VBAC as opposed to a planned C-section is avoiding a major abdominal surgery and the risks and complications that can come with that, including less chance of infection, less blood loss, and therefore less need for a blood transfusion, generally a shorter hospital stay and a faster recovery, although vaginal deliveries can sometimes have circumstances that end up in a longer hospital stay or a more complicated recovery. There's also less scar tissue in your uterus with a VBAC, so there's less chance of having problems with the placenta in your subsequent pregnancies. In terms of benefit to the baby may possibly have an easier time breathing at birth because when they go through the birth canal, the excess water in their lungs is squeezed out. And as the baby goes through the birth canal during a VBAC, they're exposed to mom's microbiome or good bacteria, and research has shown that to be beneficial to the baby. These are just some of the physical reasons someone might choose a VBAC over a planned C-section. There are other majorly important things to consider, one of which is how big of a family mom wants. If a family wants to have maybe 3+ children and they already have a C-section from a previous pregnancy, then the risk during the pregnancy and the delivery goes up with each subsequent C-section scar. So couples who want a larger family may want to start considering VBAC as opposed to planned C-section. And the other thing that has to be considered and isn't often talked about in these types of pros and cons conversations is that women seeking a VBAC are doing so largely because they really want to have the experience of a vaginal birth and all of the things that go along with that. And so just the passion for having a vaginal birth, in addition to all of the benefits of it, needs to be considered with your OB and your family. By the way, if you have more questions for me or you want to learn more about a specific topic, please leave a comment below. Also, if you are interested in learning about how to have a faster and easier delivery and a more comfortable pregnancy, I have put together a program that brings together all of the insights I've learned in my years in labor and delivery and in helping women just like you achieve the delivery of their dreams. This program includes everything you need to prepare your body throughout your pregnancy, and you'll have 24/7 access to me to answer your questions and provide coaching as you go through your pregnancy and your delivery. I will help you learn exactly what you need to feel fully prepared and confident for your delivery through weekly online live group coaching and Q&A sessions, easy to watch bite-sized videos containing information you won't find in other birthing programs, and full-length yoga classes specifically designed to prepare your body for delivery. For more information on my program, click on the link in the description. Now, we also need to talk about the cons of having a VBAC so that you have all the information to make the right decision. There is risk associated with the trial of labor after C-section, or TOLAC, and the big one your OB is going to worry about is uterine rupture. Uterine rupture is exactly as it sounds. Scar tissue is never as strong as untouched tissue. And so in subsequent pregnancies and labors, there is a risk that that scar from your previous C-section could open or tear. Now, this tear can be large, this tear can be small. Either way, it's a risk to the life of mom and baby and requires immediate surgery. The risk of this happening is about 1 in 200. Which is considered a pretty small absolute risk. The other major risk is that after hours of labor and pushing, you may still end up with a C-section, and in that instance, you are increasing your risk of infection. When we talk in general about the safest way to deliver a baby, the safest or the most preferred is a vaginal delivery. The second safest is a planned C-section. The least desirable is to have a C-section in the progress of labor, meaning that something has happened during your labor and pushing, and it's required you to go for C-section. For many women, the benefits of having a vaginal birth after C-section or a VBAC outweigh the risks we just discussed. And remember, 60 to 80% of TOLACs, or trial of labor after C-section, will end up in a vaginal birth. So how can you and your OB decide if a VBAC is right for you? It's not just about risks and numbers. There's many other things to consider, and it's a very individualized decision. The first thing to talk to your OB about, we've already touched on, and that is how many more children you want to have. If you're planning a large family, then you may have to have a pretty in-depth conversation about the benefit of a VBAC to you as opposed to the risk. Your OB will also consider your height, weight, and age. So the data show that an age less than 37 and a normal height and weight have a greater chance of the TOLAC ending in a VBAC. This would not disqualify you from having a trial of labor, but if you personally don't want to go through labor and pushing and then end up with a C-section, then this is something that you might need to consider. Your OB will consider whether or not you're being treated for high blood pressure prior to your pregnancy. The data show that women who have high blood pressure prior to pregnancy have a lesser chance of their TOLAC ending in VBAC. Again, this wouldn't disqualify you, but it is something that you'll have to include in your conversation with your OB. The other thing your OB will consider is the reason for your previous C-section. If your C-section was for something like the position of the placenta or the baby being breached, these are not things that will necessarily recur in your next pregnancy, and you would know about them ahead of time. So there would be no reason to suspect that a TOLAC would not end in a VBAC. There are other reasons why women have C-sections that we know have a greater likelihood of recurring in pregnancy, and that might be a reason for your OB to feel concerned about offering a VBAC. The last thing your OB needs to consider is the location of your previous C-section scar. Most women nowadays will have what we call a low transverse cut, which is sort of like along the bikini line. But the only way you can know for sure is to look at your medical records, because sometimes the incision on the skin is not in the same place as the incision on your uterus. And we want the incision on the uterus to be in that low transverse area because that's the non-contractile part of the uterus. That muscle doesn't contract in labor, and so there's much less chance that it will rupture. Another thing women often ask as they're planning whether or not they want a VBAC or a planned C-section is whether there's anything they can do to prepare in advance to increase their chances of having a vaginal birth. The answer to this is yes. As with any pregnancy, there's a lot a woman can do to give her baby and her body the best chance of a vaginal delivery. My program, the Empower Your Birth program, is an amazing resource if you're ready to start preparing for birth, and it's linked in the description. As you can see from this, the decision to have a VBAC as opposed to a planned C-section is not as black and white as it was once thought. Many more women are being offered trials of labor after their C-section, and OBs and nurses are gaining ever more information and skill in helping women navigate this. I hope this information has helped you feel much more prepared to talk to your OB about your VBAC. Ultimately, it's a highly individualized decision, and the next best step for you is to find a provider who's willing to have that detailed conversation with you. Thank you for watching. If you liked this video, then please like and subscribe, and I'll see you in the next video.